You're welcome back. Now, the World Health Organization is warning against jumping to conclusions about the efficacy of coronavirus vaccines. This is after a South African study suggested that the AstraZeneca jab was less effective against a local variant of the virus. But experts are hopeful that the vaccine will still be effective at preventing severe cases. We'll go live to get into the details of the vaccines. Joining me via Zoom is AUDREY CHIMWANDA-THWALA. She's a journalist and news anchor with Galaxy Universal Network. AUDREY, thank you very much for your time. Let's take a look at your case count. How are the numbers looking in South Africa?
A very good evening to you and to the viewers. The numbers have been looking very good of late. As you know, South Africa has had one of the largest numbers of infections across the continent. We've been experiencing what is called the second wave of infections. But just taking a look at the numbers that were released yesterday by the head of department of health, we seem to be doing really well. And it appears that, the main provinces, like the capital in your Gauteng province, where I'm actually talking to you from, where there is the capital city, that's where the hotspots would then be realized. But otherwise, looking at the curve, it's really going down. We're looking at a cumulative number of just under 1.5 million cases at the moment. And, since SA began its second surge, however, 183 people are confirmed to have died as of yesterday alone, which is still a relatively high number if you compare to other countries.
That's terrible. That's a difficult situation to deal with. But South Africa has been able to handle it up until this time, with some restrictions and some other interventions. What restrictions are still being implemented at this point to deal with the situation?
So just about a week ago, we had an address from the President, Cyril Ramaphosa. We actually had to go to a bit of a stricter lockdown. We are at level 3, which speaks to, your congested areas like your taverns, your gyms having to be closed, the sale of alcohol having to be banned. But all that has actually been, released of late. People are able to, buy their alcohol, which really has been such a huge relief to some people who enjoy having their good time. Gatherings at church also are being allowed at the moment because, the department is very confident that they have a good hold over this, especially the new variant that we're having to deal with in South Africa at the moment. I'd like to believe you'd have heard of it. We got our first batch of vaccines that came just a few days ago, which still has a bit of problems, and I hope that we'll be able to get into it a bit later on. But in terms of our beaches, our open spaces, our parks, they're all open at the moment. Your churches, people that can go to work, but of course within the lockdown restrictions of not having more than half of the capacity of any entity that holds people at a time.
What over here in Ghana, one of the biggest problems for us is adherence to the COVID-19 protocols, and so we haven't had any the sort of restrictions that we've seen in South Africa, including we've only had one lockdown, for example. But to what extent do people comply with these protocols? And after that, we go into the conversation about the vaccines.
Yes. So South Africa has had one of the most stringent lockdowns worldwide compared to the whole world. I'm sure you remember at some point that actually banned the sale of cigarettes because, COVID-19 is a respiratory lung disease. People just wouldn't be allowed to go to work. The curfew at the moment is between 11 p.m. and 4 a.m., which is one of the most relaxed that we've had for a very long time. We've got certain areas within the country that is a bit more resistant when it comes to obeying the lockdown regulations, like your Western Cape province, which ironically is actually one of the provinces that has one of the highest numbers of people that are infected with COVID-19. Just recently, we had protesters going to the beaches. It's a coastal city in Cape Town, protesting that their civil liberties are being infringed on by the government, by them not allowing them to go to the beach. So we do have a few people that are starting to have what is called a COVID-19 fatigue in terms of adhering to wearing a face mask, observing social distancing, and observing all the rules and regulations that have been put down by the government.
Let's talk about vaccines. Think about last week. I was just watching the news with so much excitement when South Africa received the first tranche of the AstraZeneca vaccine. And just about yesterday, I was watching the news again, and I understand that it's not as the efficacy level doesn't seem to be working very well with the apparently local variant. Educate us a bit more on this development.
You know, that's exactly how we felt here in South Africa, because the government had told us that would get the first batch of 1 million doses that actually arrived just a few days ago. About 6 days ago, we received the first batch. But just 2 days ago, we then realized that that batch is actually expiring in April. That's in a few weeks' time. And not only that, the most devastating news that we heard is that this particular, it's called AstraZeneca COVID-19 vaccine is not actually, its efficacy levels are not really strong when it comes to the variant that is unique to South Africa. But then, of course, you can't blame the government for that, because that time they procured it, they were still dealing with the first variant. So the decision that had to be made by the government was to stop the whole vaccination program, which was supposed to have started in about 2 weeks' time, while they do more research and more, efficacy tests to make sure that, people get the right medicine. At the moment, we're looking at Johnson & Johnson. They've come into play. They have promised that they will be able to give us a batch of, a vaccine that can actually match up to the new variant that we have here in South Africa. So we're hoping that that will happen soon. The government had procured close to 20 million dosages of this. There's another 500,000 that we're expecting to come in the next couple of weeks, which again does us no good when it comes to the efficacy levels of the variant that we have here in South Africa. So it was a bit of an embarrassment on the part of the government to have to deal with that, particularly with the issue of it having to expire any day now. So what they've done is they've gone to the institute that supplied us with that vaccine to see if they can return the batch so they can get a new one that is a more extended date when it comes to the duration date.
Well, I'm very hopeful that that process, will go on smoothly and that they'll be able to have that nice exchange. But the public reactions, I'm wondering what it has been to this false start.
Huge disappointment, a lot of criticism that is coming from not only opposition parties like the Democratic Alliance, but just, having the confidence in the public. They seem to have waned. The public doesn't seem to have as much confidence in the government as much as they had a few days ago, considering that we literally had the president of the country go to the airport and receive this batch of vaccines that we had been promised, that this is our lifesaver, and literally inspected it in front of the whole world, in front of the whole country, and told us that, this is the hope that we've all been waiting for, only to find out that we've been sold a dud. So a huge disappointment, a lot of criticism that is coming from opposition parties. They've now written to Parliament saying that we want the government to account how they could have lapsed in such oversight in terms of, procuring a vaccine that is going to expire any time now. But the explanation that has come from the manufacturers is that given, the clinical test that they've done at the moment, they can only give an expiry date of end of April, and they can't help us with anything at the moment. So the country is looking at other manufacturers to see if we can get other batches. But now we're looking at taxpayers' money. Over 40 million rand that was used to procure this seems to be going down the drain anytime soon. And I can tell you that the citizens are not happy at all.
Well, like you said, they're talking about, they're trying to figure out this arrangement where they can have this exchange. So hopefully that works as well. But what does this do to all these conspiracy theories that came up? Because people were apparently apprehensive about doing the vaccine in the first place, to think that it came in, and then the concern is that it doesn't really address the problem that we sought to do. I believe that this will have an impact on the conspiracy theories that have been going around. Is it?
It has actually been called, the second pandemic that we're having to deal with, especially here in South Africa. The conspiracy theories about the 5G having, precipitated this COVID-19, Bill Gates, and pharmaceuticals that are trying to profit by actually creating this virus so they can provide and supply the vaccine. And now a lot of people have a lot of doubts in their mind. I'll tell you about a study that was recently done here that suggests that only about 52% of of citizens here in South Africa are willing to take the vaccine. So the government needs to take that into account, considering they're looking to have what is called a herd immunity. That means immunizing at least 65%, at most 65% of the population, to make sure that they have a hold and curb this COVID-19. But from the looks of things and from the surveys that have been done, it'll be difficult to get to those numbers. So a lot of campaign awarenesses have to be done from the government to make sure that people understand why this is important. But given the recent events, of course, that we've already alluded to, of having vaccines that are expired, people are already worried about, the reactions. I'll take you back to the vaccine trials that we had here in South Africa a couple of months back, as they were trying to ascertain which type of a vaccine is appropriate for people that live here in South Africa. And there were a bit of side effects that people experienced. They were mild. No one died that we know of. There was no report of anyone dying, but people complained of muscle pains, of headaches, nausea, and red patches, where they'd gotten the jab. So such fears have really not helped with the conspiracy theories. And really, there hasn't been transparency. And this is what, others in the government have been calling to say, we want to understand what plan you have with regards to this vaccine, not only the procurement process, but also raising awareness on who you're dealing with, who you're paying the money to, and why you chose those people.
Transparency, you say. That before you go, the WHO is saying that this should not hurt the confidence so much because all is not lost. Apparently, there are further tests that should lead to the conclusion that this can actually help for people in severe or people with severe COVID-19 infections. What can you tell us about that?
That is actually true. Yes, that is actually true, that AstraZeneca actually helps those that have, severe symptoms. But looking at the number of people that have been infected here in South Africa, most of them actually have mild symptoms. So you would expect that the first batch is actually going to help those. So that is where the problem starts. So it is not all lost, but the number of people that it would service is really a drop in the ocean compared to the number of people that they were hoping to service and make sure that they have access to this vaccine. The government spoke of a 3-phase plan when the vaccine comes. Phase 1 that concentrates on the healthcare workers, that most of them, obviously haven't really been affected. We've got a huge number of people that have been affected, but most of them haven't. Healthcare workers to be the first ones to get vaccinated, and thereafter we get to the elderly and to people that have comorbidities like your HIV, your diabetes, and your blood pressure, and people that are in prisons as well, people that congregate in closed spaces. So looking at the doses that have come so far and the efficacy levels that it has, it doesn't really help the majority of people that have been infected. Only a small number of people have severe symptoms here in South Africa.
Well, I'm hoping that the lessons that have been learned will be applied in the next procurement, hopefully. But if I were to ask you to advise, to get a South African advice for Ghanaians who are anxiously waiting for our own tranche of our first batch of vaccines, what would that be, briefly?
Learn from our mistakes. That would be my first advice to you. I think the advantage of not being the first, South Africa is considered to be one of the richest countries in Africa, but I think it's safe to say that, mistakes are expected to happen. This is unprecedented to most governors. They're still trying to figure out how to map out the logistics, the distribution, making sure that it's safe, making sure they get the right vaccine, that is not going to expire. So I think a lot of work and research needs to get into the logistics and really just learning from the mistakes that of others that have started before you, such as South Africa.
I'm certain that our authorities are learning from the South African experience. Audrey, thank you so much for elaborately breaking it down for us from there. Audrey Chimwanda-THWALA is a journalist and an anchor with GAM TV in South Africa, joining us live all the way from there. Well, will we learn from that experience? Let's hope so.